Irritable bowel syndrome, or IBS, is one of the most common digestive disorders affecting millions of people worldwide. This condition is characterized by functional disturbances in the intestines, leading to abdominal pain, bloating, and recurrent episodes of constipation or diarrhea. While IBS is not considered a serious disease, it can be highly uncomfortable and significantly impact the quality of life. In this article, we will explore the causes, symptoms, and effective treatments to manage IBS and improve daily well-being. IBS is a functional gastrointestinal disorder, meaning that it affects the function of the intestines without causing visible damage to the tissues or severe inflammation. This disorder leads to irregular bowel movements, excessive sensitivity in the intestines, and digestive discomfort. People with IBS frequently experience cramps, bloating, and either constipation or diarrhea, often triggered by stress or certain foods. Although the exact cause of IBS remains unknown, several factors contribute to its development. Some people experience rapid intestinal movements, leading to frequent diarrhea. Others suffer from slower bowel motility, resulting in chronic constipation. Individuals with IBS have hypersensitive intestinal nerves, making them more prone to pain from minor bowel contractions. Psychological stress and anxiety play a major role in worsening IBS symptoms since the nervous system directly influences bowel activity. People suffering from depression or chronic stress are at higher risk of developing IBS. Women are more likely to experience IBS due to hormonal fluctuations, particularly during menstruation or pregnancy. The colon is home to billions of beneficial bacteria that aid digestion. Any imbalance in this microbial ecosystem can trigger IBS symptoms. Certain foods can irritate the digestive system and worsen IBS symptoms, including fatty and fried foods, carbonated beverages, caffeine, dairy products for those with lactose intolerance, and beans, cabbage, and broccoli, which can cause bloating. IBS symptoms vary from person to person and can range from mild to severe. The most common symptoms include abdominal pain and cramps, which often worsen after meals and improve after bowel movements, bloating and excessive gas, chronic diarrhea, constipation or alternating between both, a feeling of incomplete bowel movements, mucus in the stool without blood, fatigue and general discomfort, and sleep disturbances and anxiety. Although IBS symptoms can persist for long periods, they do not lead to serious complications such as colon cancer or ulcers. While there is no permanent cure for IBS, lifestyle changes, dietary adjustments, and stress management can significantly reduce symptoms. Adjusting your diet. Increase fiber intake by consuming oats, fruits, and vegetables to improve digestion. Avoid trigger foods such as fried and spicy dishes, carbonated drinks, and caffeine. Drink plenty of water daily to maintain bowel regularity. Try a low FODMAP diet, which helps reduce bloating and gas. Reducing stress and anxiety, practice relaxation techniques such as yoga and meditation. Avoid stressful situations whenever possible. Get enough sleep every night. Engaging in regular physical activity, walking for 30 minutes daily, helps improve bowel movements and reduce stress. Yoga and deep breathing exercises can help calm the nervous system. Using supplements and probiotics. Probiotic supplements containing beneficial bacteria can improve gut health. Consulting a doctor when necessary. In some cases, a doctor may prescribe antispasmodic medications to relieve pain. If chronic diarrhea persists, antidiarrheal medications may be recommended. Some individuals benefit from low-dose antidepressants, which reduce gut sensitivity to pain. IBS is a common but non-life-threatening condition. By adopting a healthy lifestyle, managing stress, and avoiding trigger foods, symptoms can be significantly reduced, leading to a better quality of life. If you suffer from IBS, try the recommendations mentioned above and consult your doctor if symptoms persist. Golden tip. Keep a food diary to identify which foods trigger your symptoms and avoid them. Do you have any tips for managing IBS? Share your experiences with us. Irritable bowel syndrome, or IBS, is a common disorder that affects the digestive system, particularly the large intestine. It is a chronic condition that requires long-term management. Although IBS is not a life-threatening disease, it can significantly impact quality of life due to its uncomfortable and disruptive symptoms. This guide provides a detailed explanation of IBS, including its symptoms, causes, dietary recommendations, and management strategies to help those affected live a more comfortable life. IBS is a functional gastrointestinal disorder characterized by abnormal bowel movements, increased gut sensitivity, and digestive discomfort. People with IBS often experience abdominal pain or cramps, bloating and gas, diarrhea, constipation, or both, also known as alternating IBS. Additionally, changes in stool consistency and a feeling of incomplete bowel movements are common. In some cases, non-digestive symptoms like fatigue, headaches, and anxiety may also occur. The exact causes of IBS are not fully understood, but several factors contribute to its development. These include abnormal bowel movements, either too fast, resulting in diarrhea, or too slow, leading to constipation. Hypersensitivity of digestive system nerves can lead to increased pain perception. Mild inflammation in the intestines affects digestion, and changes in gut bacteria or microbiome result in an imbalance of good and bad bacteria. Psychological factors such as stress and anxiety also affect gut function. Lastly, genetic predisposition plays a role, as IBS may run in families. Currently, there is no permanent cure for IBS. However, symptoms can be effectively managed with dietary modifications, such as avoiding trigger foods. Stress management techniques like yoga and meditation can be beneficial. Medications can relieve symptoms like cramps, diarrhea, or constipation. And if stress or anxiety is a major trigger, psychological therapy can be quite helpful. If you experience IBS pain, try these proven relief strategies. Use a warm heating pad on your abdomen. Practice relaxation exercises like deep breathing and yoga. Take antispasmodic medications to reduce cramping. Avoid trigger foods such as dairy, gluten, and caffeine. Drink soothing herbal teas like peppermint or ginger tea. People with IBS benefit from a balanced diet that supports gut health. The best dietary strategies include following a low FODMAP diet, limits hard-to-digest carbohydrates to reduce bloating and discomfort, eating soluble fiber found in oats, bananas, and sweet potatoes to improve bowel movements, avoiding fatty, fried, and spicy foods which can irritate the gut, eating small, frequent meals instead of large ones to ease digestion. Some foods can worsen IBS symptoms, so it's important to identify and avoid them. Dairy products for lactose-intolerant individuals. Gluten-rich foods like bread and pasta for those with gluten sensitivity. Legumes such as beans, lentils, and chickpeas because they cause gas. Cruciferous vegetables like broccoli, cabbage, and cauliflower, which are hard to digest. Carbonated drinks and caffeine can increase bloating and diarrhea. People with IBS often face daily challenges such as managing unpredictable symptoms that affect work and social life, finding dietary solutions that reduce discomfort, dealing with the psychological impact like stress, anxiety, and frustration, and learning what works best through trial and error with different diets and treatments. Although IBS cannot be cured in just 1 week, symptoms can significantly improve by following these steps. Strict diet, eliminating trigger foods, and following a low FODMAP plan. Drinking plenty of water, at least 8 glasses per day. Engaging in light exercise. Walking or yoga to aid digestion, and using prescribed medications such as antispasmodics, probiotics, or fiber supplements. Regular physical activity can help stimulate bowel movements, reduce stress, and relieve bloating. The best exercises include yoga, which improves relaxation, and digestion walking, which stimulates the intestines and prevents constipation. Deep breathing exercises to reduce stress and gut sensitivity, and stretching exercises to relieve abdominal cramps and tension. IBS and ulcerative colitis, or UC, are both digestive disorders, but they have key differences. IBS is a functional disorder, which means there's no physical damage. In contrast, ulcerative colitis is an autoimmune disorder that causes inflammation. The symptoms also differ. IBS typically involves cramping, bloating, diarrhea, and constipation. On the other hand, ulcerative colitis is characterized by bloody diarrhea and severe inflammation. The causes are distinct as well. IBS is often linked to gut sensitivity, stress, and diet. Meanwhile, ulcerative colitis is caused by the immune system attacking the colon. When it comes to treatment, IBS can be managed with diet, stress management, and medication. Ulcerative colitis requires anti-inflammatory drugs and immune suppressants. Here are some of the best soothing drinks for IBS. Peppermint tea. It relaxes gut muscles and reduces cramps. Ginger tea. This helps with bloating and nausea. Warm lemon water. It stimulates digestion and reduces discomfort. Chamomile tea. It calms nerves and relieves digestive stress. To reduce bloating and excessive gas, try these simple tips. Avoid gas-producing foods like beans and cruciferous vegetables. Eat slowly and chew food thoroughly to reduce swallowed air. Drink water regularly to support digestion. Exercise daily to keep the digestive system active. Use anti-gas medications such as simethicone. Common causes of bloating include excess gas buildup in the intestines, overeating fatty or heavy foods, food intolerances like lactose or gluten intolerance, and constipation slowing down digestion. Effective treatments are dietary changes to reduce gas-producing foods, taking anti-gas medications to relieve discomfort, and improving eating habits by chewing food well and avoiding large meals. Some natural treatments can provide relief from IBS symptoms. Probiotics support a healthy gut microbiome. Peppermint oil relaxes intestinal muscles and reduces cramping. Soluble fiber improves digestion and prevents constipation. Acupuncture may help regulate gut function. Stress management techniques like meditation and yoga help balance the gut-brain connection. IBS is a chronic but manageable condition. By following a proper diet, reducing stress, and adopting a healthy lifestyle, symptoms can be effectively controlled. If you have IBS, keeping a food diary, trying different dietary approaches, and consulting a doctor can help you find the best treatment plan. Golden tip: listen to your body, identify trigger foods, and maintain a balanced lifestyle. Have you found effective ways to manage IBS? Share your experience in the comments.